Okay, thank you very much. I'm very happy to be here. And so it's super important in life to be happy, actually. And in order to be happy, I could present all my talk with my pen just in my teeth like that. Because this is the theory behind this paper. This is a paper that says that when you are smiling, and of course when you are doing this, you are smiling, you are more happy because of facial feedback. This is the idea. And then they took two groups, one group doing this, smiling, and the other putting the pen just here, obviously not, not smiling, with a duck face. And actually, they compared the group and they found that the group with the pen just in the middle of the teeth was happier than the other when they looked at cartoons. So this was this theory. This is a paper in psychology that has been cited a lot, and it was like a proof of the facial feedback hypothesis. Maybe because of the emotion that are on your face, even if it's artificial, it can induce your own emotions. So this is one paper that was published, and that was very important. Well, a few years later, so actually a lot of years later, and after a lot of citation, a team of actually many scientists, so many different independent teams joined in the same team to perform various reanalysis of this paper. And here you have the results. So almost no effect for this result, a result that was not reproducible. So you would say, okay, this is just an example. This is just a funny example because, and obviously it's not reproducible, so there is no effect. So you are lucky. I can present my talk without my pen in my mouth. But actually, you would say this is an isolated example, but it was not. And actually, in the scientific literature, we have many, many other problems of reproducibility. So let's say people are taking into account the fact that there is problem of reproducibility in the literature, but we have to define maybe a little bit better what is research reproducibility and what does it mean. So I will take an example for that. The example that I love to take, so sorry for that because the recipe is in French. It's a recipe about Christmas meringue, about Christmas trees in meringue. So you know these are the very cute Christmas trees in meringue, and to get those Christmas trees, you have to follow a recipe. So the recipe is pretty easy. You take sugar, eggs, and so on, and you have various steps to reproduce the recipe. But this is what is written in the text. But maybe we have some what we can call degrees of freedom, meaning at each and every step, we can choose various different choice. For instance, we can uh, take more time or less time. We can take different kind of sugar, different kind of egg. We can draw, take various shape for the Christmas trees. And actually, with all these different things, we have 48 pathways, but we are taking one pathway and we are doing the recipe. What is called here? Providing sufficient detail in the method to reproduce an experiment. This is called method reproducibility. So you have sufficient details in the method that allow you for reproducing, at least in theory or in practice, the experiment. And within method reproducibility, we always have degrees of freedom that we try to control by detailing as much as we can the recipe. So this is method reproducibility, but this is not the only aspect of method reproducibility because you take the same method and you are doing the same recipe, and at the end of the day, you have the result. So these are the results that I obtained by following the method, and this is called result reproducibility. So following the same method, you get the same result. And it's not always taken for granted, as you can see. And then there is another aspect for reproducibility that is called inferential reproducibility. For instance, in this case, maybe you will be able to agree. So your conclusions when you are looking at the results are pretty the same. Those are not nice. Those are not good. And at the end of the day, they will end in the trash can with all the rubbish. And it's sometimes what happened with failed experiments. They don't appear in the literature. They end in the trash can with all the rubbish. But this is somewhat a problem sometimes. And actually, I would be much more happier to show you my good recipes. So when I have a success, for instance, here in Brittany, I'm cooking crepes. And when I have very nice crepes, I would be very happy to share my crepe with you instead of sharing my Christmas trees. But today, because this is a talk about reproducibility, I share with you my Christmas tree in meringue. Okay, so I'm not a specific funding for this for this route. So I have no specific conflict of interest with any, I would say. Industrial company involved in the business of big meringue. But I have no specific conflict of interest with pharmaceutical companies because I am a medical doctor, so this is mostly the things we are looking for. I have some conflicting, so not conflicting interest, but I have some, I got some fund from various entities, either public or philanthropies for my research. So my postdoctoral fellowship, I did it in metrics, which was funded by the Laura and John Arnold Foundation, a foundation that funds actually a lot of research in the field of research reproducibility, open science, and so on. So basically, if we are talking today about research reproducibility, this is because we have people that have put money in this kind of stuff. And this money led to more and more studies about problems of reproducibility. And it led the scientific community to be more aware about that. Is it a good thing or a bad thing? I don't know, but I think we have some to keep in mind that now there is some money in the field of reproducibility. And I have also some money from various public funder, and actually by the European Union for a project that is called OSIRIS, Open Science to Increase the Reproducibility in Science. And this is because many funders now, they have the interest in studying research reproducibility because sometimes it can be a waste for them. So, okay, let's talk about research reproducibility and what it is exactly. This is a famous paper in Nature that was a survey of scientists, and they were asked if there was research reproducibility. The figure is here, and you can see that a large number of people in red believe that there is, reproducibility crisis, like something that is crisis. So I found this figure very fun because you have 52% of people consider that there is a significant crisis and 38 just a slight crisis. So for me, a slight crisis doesn't exist because either it is a crisis or it's not a crisis, but a slight crisis is like, okay. But the thing that is more important in this Nature paper, maybe it's not the figure in itself, it's what you can see on your right, on the right of the slide. This is a quote. Reproducibility, it's like brushing your teeth. So once you learn it, it becomes an habit. And I would say that this is a quote that it took me a while to understand because at the beginning, I was not understanding this correctly. But once I went to my dentist and I showed my teeth and he said, "Oh, Florian, you have a problem. You don't know really how to brush your teeth." And then he took all this stuff, he went in my mouth, and it was a total slaughter. So actually, it's super important. Those are very small things to ensure reproducibility, maybe, or at least small things that we believe might ensure better reproducibility. And those small things are not so difficult to do, but if you don't do those things, it might be difficult. And one of the first thing is to base your research on, prayers that are totally correct and reasonable. It might be informed, for instance, by a systematic review to make good prayers. And come on, here, in this study about smiling, do you really think that the face value of the prayer is good? So, meaning you're looking a cartoon like that, you will be happier than if you look a cartoon like that. So the face value of the prayer is not so high. And in many research, we don't have very good prayers before doing the research. And without strong prayers, maybe we won't have good results if we are in a Bayesian perspective, at least. Here, another example. This is an example about full moon. People have studied, this is in a major psychiatry journal, whether there was a peak in suicide during full moon. So this is actually a study based on very low prayer. And actually, this is quite recent study. It was published, I think, in the end, so maybe in 2019 or something like that. But actually, since 1985, we knew that there were almost nothing to connect between mental health and the full moon. And then you fail to control for bias when you generate your hypothesis. And then what can happen? It can happen that you are performing many statistical analyses under various scenarios because you can have those kind of degrees of freedom that we saw with the recipe of Christmas tree meringue, but you have the same degrees of freedom when you are doing your analysis, and maybe you can be also tempted to make your hypothesis after the results are known, meaning that you are attempting to interpret the results you found after doing sample hacking. And I think this could be conscious or not conscious. And many things can happen because we don't control for all the degrees of freedom we have. And actually, we can see this in medical studies because there are degrees of freedom that relates with method flexibility. So for instance, in interventional studies, in therapeutic trials, we try to control method flexibility by using randomization, for instance. But when you have no randomization, you have to account for confounding in a way or in another. So you have to decide which confounder you will include in your model and so on. And you have a lot of degrees of freedom. We can have also degrees of freedom that improves that more and more degrees of freedom between data that you have collected for research purposes, that you have controlled since the beginning, what kind of data you want for your study, and data that is routinely collected. This is a super important source of research data. But those routinely collected data are not always collected as you would like. So you have to make some choice to define, let's say, the exposure, or let's say the outcome. You have to define what could be the outcome and the exposure, and you have to make some choice. For instance, if you have a medical administrative database, maybe you won't have the diagnostic, but you have the drug. So based on the drug, you have to decide which will be the diagnostic. And there is also degrees of freedom. And more we are doing secondary analysis. So for instance, for clinical trial, more and more we are going to share the data and to reuse data of the other. And this has a new degree of flexibility and degrees of freedom between considering the formulation of your research hypothesis between primary analysis, which is done for the purpose of exploring your hypothesis, and secondary analysis, where the hypothesis come after the data set. So basically a retrospective analysis of a given data set. And degrees of freedoms increase with all these three axes, I would say. And currently, in medicine, we are mandated only to register studies, so to provide details on what we aim to do and what we want to do, only for this kind of primary analysis of interventional study. For the other, there is no need, actually no mandate to register the study, but actually a lot of degree of freedom, and also a lot of challenge in registering. But it's not because there is a lot of challenge that it would not be worth the try. And actually, we can see that here you can have what we call vibration of effect. And this is an example in epidemiology. It's about an epidemiological study that try to assess a link between blood pressure and a drug, lisinopril. And you can try to control for many confounder. You can try to implement a lot of variables in your model. And if we take all existing variable, which is quite okay, agnostic, under all possible scenarios that would be possible to imagine, we can compute all the different effect estimates with actually here various different p-values, and here below this line, black line here, you have p-values that are above 0.05, and here you have p-values that are below 0.05. So actually you can find models that go in two directions, two very different directions in terms of estimation. And this is true, of course, so for observational 2D and selection of covariates in models, but it happens to be the case also for meta-analysis. So I am more a meta-analysis guy than a epidemiology guy. So I will give you some examples. So you know that more and more we are producing meta-analysis, and sometimes those meta-analyses have conflicting results. For instance, in the field of network meta-analysis, we found that many network meta-analysis had redundant meta-analysis on the same topic. And among those network meta-analysis, in certain fields, this was totally crazy. For instance, in the field of rheumatoid arthritis, sorry, we saw that we had each column here is a network meta-analysis. So we saw we have a lot of overlapping meta-analysis. And none of this meta-analysis was complete, and none of this meta-analysis was up to date. And actually, when you look at those network meta-analysis, you had several that provided results that were in different directions. Not that much, but some. And this is a problem because a meta-analysis is supposed to be exhaustive. It was not. It's supposed to be reproducible. It was not. And it's supposed to be a synthesis. And in certain fields, we have more meta-analysis than original studies, meaning that doing the synthesis of more synthesis, it's a more complex task than doing a synthesis of all the individual studies. Where I tried to list all the possible PICOs for performing an indirect comparison. You know, PICOs are patient, intervention, comparator, outcome, study design. Those are basically the selection criteria for all the studies you will put in your meta-analysis. And then we had exactly like the example for the meringue, the possibility to run more than 9,000 meta-analysis on the same topic. It was an indirect comparison. And then we get this kind of figure with results that could go in either direction. So superiority on one drug versus other, superiority of the other, and also a lot of meta-analysis without identifying differences. But this can try to map a little bit the extent of the difference we can find sometime in the literature, because it's not hard to identify meta-analysis that are conflicting regarding the results. And actually, I was saying that we tried to do the same kind of experience, the same kind of meta-research in the field of acupuncture. And it was pretty easy to find some sort of vibration of effect here too, because acupuncture is a very complex intervention, and it's very easy to make as much as PICOs as you want with acupuncture, because each and every way to perform acupuncture is different from the other. So it's very easy to perform a lot of systematic review and meta-analysis in this field. And again, a field where you have a lot of overlapping meta-analysis. We try to explore also vibration of effects in the field of individual patient data meta-analysis. And actually, we found much less than in other fields. Um, Perhaps this is because of the case study we had and because there was a big effect for this drug on the outcomes. And we explored this also in the context of network geometry in network meta-analysis. But actually, we found some sort of vibration of effect in, in most meta-analysis. And this is very theoretical and also maybe a little bit agnostic, because if you combine all the combination, of course, some of those combinations might make no sense, of course. And this is a critique that you can have to the approach, but it's just a way to visualize a little bit that. But another way is just to look at the literature. And here we performed a systematic, so an overview of all network meta-analysis in the field of psoriasis. And you can see that each line is a given network meta-analysis, and each column is a drug. So again, most of the meta-analysis are not comprehensive of all drugs, because you have a cross when the drug is included in the meta-analysis. So not all are fully comprehensive. And in green, you have the drugs that are, let's say, considered to be the best in the abstract of the systematic review and meta-analysis. So in green here. And actually in red, you have, when this is a commercial founder, you have the drug of the commercial founder. So you can see that each time you have a commercial founder, the drug by the same commercial founder is pinned in the abstract as the best one, which is not always the case. And actually doing this kind of more concrete exercise with the exercise of vibration of effect might inform you of several controversies in the literature. Okay, so we discussed a little bit about the failure to generate good hypothesis. We discussed a little bit about the possibility of making many analyses and pay accurate data. Now let's talk about another problem, because you might be tempted to do some pay hacking when you actually have low statistical power and you are a little bit disappointed by your result. And low statistical power is quite frequent in the literature. Here I take an example with um, studies in the field of repetitive transcranial magnetic stimulation. So this is something that you put a coil on the head to make some magnetic stimulation, and you try to improve the various kind of disease with that. So actually, this kind of treatment has been studied in stroke patients, in cognitive impairment, in chronic neuropathic pain, so in many indications, both in neurology and also in psychiatry. Actually, we found a total of 228 studies, randomized control trials studying this. And we found 5 studies here in aphasia, for instance, and 3 out of those in cognitive impairment in Alzheimer's disease, and 6 were positive, and so on. Blah, blah. We look at how many were considered to be positive. So the only field was motor function after stroke, no miracle, 8 studies, 0 positive. But for all the other fields, you have a lot of positive trials. But actually, we also look at the size of the trial. And most of those 228 studies were very small. Actually, we were able to compute the power of those studies in order to identify effect size. So of 0.2, 0.3, 0.5, 0.8. Of course, 0.2, it's a very small effect size, and it might be difficult to identify, but you can look that all studies have a power a power smaller than 20% if we want to look at this kind of effect size. If we want to look at effect size of 0.3, most of studies have a power smaller than 0. So 30%. If we are starting to look at effect sizes that are quite correct and might be the effect size we would expect for this kind of drugs or the therapies, effect size, so most of studies have power beyond 60%. And even if the power was the effect size was very big, 0.8, I think a lot of intervention in medicine never get this kind of effect size. Well, even for those, you have very few studies that are above 80% of power. So many of the studies are under power. So we have some individual studies, we have some positive studies, and we are able to compute how many positive studies we would have expect under the different power hypotheses. So for instance, if we have the power hypothesis that the effect size of TRMS across all the conditions, which is a strong hypothesis, is 0.3, actually we would have only 35 studies out of 228 that could provide an answer. But we have 84 in the literature, so maybe an excess significance bias if we are under this range of effect size. If it's 0.5, the effect size, we also might have some excess significant bias, but not if it's 0.8. But still, we have a lot of negative studies in this area because we have no sufficient power. Another aspect for reproducibility, so like brushing your teeth, it should be simple, it's to make some quality control on the data. And sometimes it happens that there is no quality control. So I have a question for you now. Can you find some problems with this data set? So this is a study about folate and mecobalamin on hip fracture in patients with stroke. And this is the famous table 1 in the randomized control trial. So now this is a small training for you. Can you spot data quality issue with this data set? Okay, it's sometimes super difficult to find this. I will give you some sort of trick. This is a fraudulent trial. So now, can you can you spot the problems in the data set? Okay, I will help you now with this. What? Here. As you can see, actually, there is an excess of homogeneity. The percentage of female here is exactly the same in this group, in this group. Actually, the number are exactly the same. You might say, okay, it could be stratified and so on. It could be whatever you want. It's possible. But then the duration of illness, wow, it's very similar across group, exactly the same mean. Now the Bartel index, oh, exactly the same, yeah, standard deviation. Degree of hemiplegia, oh, look, exactly the same between groups. Fallers, ah, look, exactly the same between groups. So this is a problem in terms of quality control, maybe for the experience, but also maybe from the journal. And actually, we can see sometimes this kind of problem of the literature. And sometimes, so this one was retracted, but when I find some clinical trials with this kind of problems in the clinical trial, and when I send some message to the editor, and when I post on PubPeer, sometimes it takes a long, long time to correct the literature. This one was retracted. Actually, it was pretty easy to retract it because it was a paper by Sato, which is a world record person for retracted articles. So when you have one, um, actually, it's much more easier to retract much other following this because the investigation can come after one first. And then, of course, if you are doing this totally correctly, you have to publish your result. If you remember my meringue, I won't show you the result actually because you won't test my meringue because I won't try to show you the result. And this is exactly the same for antidepressant clinical trial. This is an old study, but it's still the best example of publication bias. You have here all the antidepressants, bupropion, citalopram, duloxetine, escitalopram, fluoxetine. And you are here the trials, the positive ones and the negative ones. Okay. And each trial is numbered with a number that comes from 1 to 73. And if you have a very close look at the figure, you will see that we don't have all trials. Because what is here, I'm showing you the trials that have been published in the literature. The author, Eric Turner, went into the FDA database to have a full picture of the antidepressant clinical trial. And here is what is in the FDA database. So you can see in the literature, here in the full FDA database. And you can see for citalopram, for instance, that 4, 5, 6, 7, 8, well, 6 and 7 were published as positive, while they were considered as negative by the FDA. Okay, so those are the problems. So like you don't brush your teeth very well. So now where are the solutions? You can buy a brush to brush your teeth, but you can try to control at least for bias by reading well the literature and being comprehensive. So basically by generating hypotheses that are strong, meaning that you are critical of the actual findings and you are also comprehensive, meaning that you are exhaustive. Then, of course, you can design studies with good statistical power. And again, this is a super good example because what I put here, it was that it was a multi-lib direct replication. So instead of being competitive, all those people decided to be collaborative, and the 17 independent teams gathered effort in one given studies to try to produce a strong answer. And actually, we have a strong answer. You don't need a pen to be happy. For that, I think registration is a super important step. And we have also like a pyramid that is super important. Prospective registration is super important because you can look if people have done what they wanted to do at the beginning. And it's not a problem if people change their mind. If I'm doing meringue, but instead of putting green stuff inside, I put red stuff inside to have red meringue. But what is super important is that this is transparent. I can tell you, okay, I plan to make green meringue, but then I decided to make them red for this and this and this reason. And it's much more easier to replicate the stuff when you do this kind of information. So, I mean, if people say no, prospective registration is not possible for me because there are so many degrees of freedom that I cannot anticipate. Well, it's not a problem. You just have to register that you will have degrees of freedom and how you will try to handle the degrees of freedom. And then you can make transparent where you had to make some choice, what kind of choice you made, and so on. Then summary results reporting. This is super important. Look for antidepressant, almost half is not published. This is exactly the same in my hospital if I look at clinical trials. Many clinical trials are not reporting. And what is the figure for epidemiological trial? I don't even know because those trials are not registered. So even if you register studies for this purpose, it can help to track how much publication bias there is in this area. And of course, IPD sharing, which is much more difficult to do because of the issue of anonymization and so on, would be even more better to be able to reproduce the study and to see if the results can be reproduced by using exactly the same database. Okay, so for registration, there is no big stuff. You can use the Center for Open Science that provides some tools. There are many other tools that are available, but this tool from the Center for Open Science provides you a very flexible way to register your research, and it fits many of the needs of researchers. And then you have still this kind of stuff, publication bias and arcing. And in order to try to control this kind of stuff, you have new models of publication that are called registered reports. So you submit your study at the stage of protocol, meaning that what will be explored by the reviewer is how much interesting is the research question? Is it based on strong priors? How much good is the methodology to answer this research question? And then the editor will give you in-principle acceptance. Following this in-principle acceptance, you will be able to collect and analyze the data as you plan in the protocol to write the report. And then you will have a publication acceptance based on the fact that you have done what you have promised, and then you can publish a report. And many journals are starting to use this, including Nature, for instance, but also PLOS Biology. And in the field of medicine, we have BMC Medicine that offers registered reports. So I think this is something that we need to develop. And if I have a magical wand, I would love to develop this for drugs because this is my field, therapeutics. And we proposed, like in an essay where we were invited to be somewhat delusional, to propose this kind of stuff. So basically, we have the recipe for doing more open research in the field of therapeutic drug evaluation. And it would be very important because we could put much uh, we could with this kind of pathway we could put the decision of assessing marketing approval before the results are known, and then before post-hoc interpretation of the results are here. So we could a little bit raise the bar by using this kind of pathway. And of course, as I told you, EPLA sharing is something much difficult, and there are some barriers for this. Like, for instance, the fact we are dealing with sensitive data. But actually, these barriers, when you discuss with patients who are, so this is something we work with patients, when you discuss with patients, these barriers are not so big in comparison with the benefits we can have from this data. And we should not omit that participants are generally supportive of responsible data sharing, and that they are, when participating in trial, they agree to take some risk. So the risk of re-identification of the identified individual patient data set is not so big in comparison with the other risks they agreed to take in participating in the study. But for that, we need to have well-trained experts, and we are trying here with another European project to have data sharing. And this is super important because we don't want to be those researchers and the future of medical researcher. We think that they will reuse a lot of data. And we don't want those researchers to be called research parasites, as it was called in the New England Journal of Medicine. And this is a paper by the editor of New England Journal of Medicine that called people who reuse data research parasite. And actually, it was not so fun for the people in the community. But since we are fun and even without using a pen in our mouse, actually, the people of the community decided to create the Parasite Awards to celebrate people that are reusing data. And this is super important. But they also created the Symbiont Award because you can be a parasite providing somebody share the data with you. So we need also to incentivize people who are doing those kind of open science practices. And actually, in the current landscape of incentives for research, we are not so much incentivized for that. That's why researchers are trying to put incentives that are aligned with all the steps of research reproducibility. So for instance, to provide incentive for researchers that provide open protocols, that register the study, that share the data, that have quality assurance control, that share the code, that are transparent, publishing open access, using reporting guidelines to avoid omitting stuff that is super important in the method. And actually, we and a group of researchers want to incentivize when hiring professors and when tenoring professors this kind of stuff instead of incentivizing publishing more and more. And we have a lot of initiatives that are involved in this stuff. And I think that's all. And the conclusion is that we need to align incentives on research reproducibility in order to make research that have more value and perhaps to reduce a little bit the waste in this area. Thank you very much.